Chapter 23, Week 4. Their objectives are to identify the key anatomical structures of the breast and to discuss surgical treatments of breast cancer. The breasts are a functional part of the female reproductive system. They provide milk for infants, respond to hormonal changes, and can have an effect on sexual identification and body image. The breasts are typically located between the third and seventh rib. Breast tissue can change due to hormonal changes, pregnancy, and nutritional state of the patient. With wire localization, a fine wire is inserted into the breast during a fluoroscopy. This is a specific technique used to identify the site of a suspected mass. Needle localization biopsy is the insertion of a fine needle into a non-palpable abnormal breast mass observed during a mammography. The purpose of the needle insertion is to identify the exact location of the mass for subsequent biopsy and microscopic examination. A definite diagnosis can then be made. The procedure is done under X-ray guidance and is done pre-operatively. The patient is then taken to the OR for an open breast biopsy. It is important that when the patient arrives in the OR that you do not move or remove the wire that is sticking out of the breast. It is there for a specific purpose. During a sentinel lymph node biopsy, injection of blue dye or radioactive material such as technetium-99 or both are directly injected into the breast mass or nearby. Then both materials are used to track the nodes. Radioactive material must be injected 2 or more hours before surgery in the nuclear medicine department. What happens is the dye kind of sticks to the lymph node that has suspected cancer, so that way they know where they should start biopsying. Treatment of breast cancer. A common treatment for breast cancer is mastectomies. There are 3 different types. During a total or a simple mastectomy, their entire breast is removed. The lymph nodes are not removed and the muscle and the chest wall are preserved. During a modified radical mastectomy, the entire breast is removed and complete axillary dissection and excision of the nodes. And during a radical mastectomy, the entire breast, along with the nodes and chest wall and muscles, are removed. It depends on the extent of the cancer that the patient has as to how extreme the surgery will be. They try to preserve as much as they can, and they don't want to take out your chest wall and muscles if they don't have to. During this time, the patient will need emotional support. Psychological support is critical to restoring a positive self-image. Usually when patients come in to have a mastectomy done, positioning is normally supine with the effective arm prepped and draped free. The arm board is needed. The affected arm is usually the side that affected cancer is on. So if it's on the left side, then the left arm would be out. So that way they can go out, and if they need to take out the lymph nodes from underneath the armpit, then they have access to that area. You will also require a general surgeon and a plastic surgeon. The general surgeon will come in and take out the cancer, and then the plastic surgeon will come in and try to reconstruct the breast. That could be sometimes same day when they try to close things and possibly put in a tissue expander to prepare the body for implants, or sometimes just to kind of see what they're working with when the patient has to come back and have the implants put back in. Any questions?